Hi, I'm Dr. Justin Berlin with 𝗸𝗏𝗄 Chiropractic, and today we want to go over some effective treatments used for lumbar disc problems. First and foremost here, I want to go over the anatomy of the spinal joint and the disc. You can see here we've got two bones with the disc in between. The disc is cartilaginous and it also has a jelly-like substance on the inside. It is designed to be compressed, right? It's designed to withstand a large amount of compression. People can put a lot of weight on their bodies and backs and carry that weight around, and that disc is designed to be compressed. When you sleep at night and you lay down, right, that disc naturally decompresses. This is why we tend to feel really good at night if we have a disc issue, and then first thing in the morning we stand up and we compress again and it starts to bother us, right? We get more pain, we get maybe some numbness or tingling down the leg, because quite often the reason the disc has its issue is because it's not being compressed evenly, but we get lateral misalignment of the bone, and when we get that lateral misalignment, the disc wants to bulge out the side and it wants to irritate that nerve. So if I have this lateral misalignment and I'm putting all kinds of compression into my spine, you can see that it's going to make that disc get worse. It's going to hit and irritate the nerve as it's exiting through. And so we've got to look first and foremost for the balance in the disc and how do we eliminate the misalignment in the joint. The disc is 90% water, right? So the disc is only going to go to the path of least resistance. So the chiropractic adjustment to correct the position of the bone is crucial, but there are a couple other effective techniques that we use here at 𝗸𝗏𝗄 Chiropractic to make sure that we are then decompressing and getting some of the compression out of the disc. The first one that I'm going to show here is, this is called lumbar spine distraction. And so we've got Dr. Mark here, we've got his feet strapped in, and he's holding on to a handle up underneath his head. And then what I'm going to do is open the table, and the table is going to start opening and actually cause a stretching into the lumbar spine and then decrease the compression or the pressure on that disc. And we can open that up quite a bit. We can hold him in that position for a period of time, and then we're going to start to see over time that disc is going to decompress, and we can actually pull that disc bulge material herniation back to its normal state, which is great. So then of course, returning him back to a neutral position, we usually leave a patient in that position anywhere from 10 to 15 minutes is most common. The next thing that we use are also some pelvic blocks, some pelvic wedges. This is a technique called SOT, or sacral occipital technique, but there is a disc protocol that allows us to put the discs underneath the pelvis here. And when those blocks go underneath the pelvis, they elevate the pelvis, they allow for more curvature in the back, and they also create a low degree of disc decompression and opening up that spine. So these are the three main techniques: the chiropractic adjustment to correct the position, the lumbar distraction, and then also the SOT blocking that we use here at 𝗸𝗏𝗄 Chiropractic to make sure that we are not only correcting the position, but then also decreasing the compression to the lumbar disc. Thanks for watching. We'll see you on the next video.